Hello, how are you today? Welcome to the channel or welcome back to the channel. I hope that you're doing well and today finds you in perfect peace in every area of your life. I want to take this opportunity to say thank you so much for your engagement with the channel. I thank you for watching the full video. I thank you for subscribing. I thank you for liking, commenting, the viewership numbers. I thank you for all of it. Your engagement to this channel means a lot to me. So I also want to say the full disclaimer is in my bio, in the description, excuse me, not my bio, in the description below, but I am not a medical doctor. I am a uterine health advocate. And as a uterine health advocate, my goal is to, help to remove the stigma, the shame, and the fear around discussing the function, the concerns, and the issues regarding our womb. And I hope to bring about awareness about our uterine health, to be honest with you. And I hopefully, as you are, stopping on this channel and you're seeing the various topics, it will allow for you to have a great conversation, not only with the men and women in your family, but also with your group of friends as well. And my whole point too is I hope that this also brings about you learning something that you can bring to your doctor and you both can develop a plan, or your team can develop a plan of healing that works best for you from all of this wonderful information that I'm sharing. Okay, so uterine health, let's talk about it. So in the previous video, I provided information about urinary tract infection and how it impacts, our uterine health. And so if you want to, watch that video in full, you can go back and watch that. Highly encourage that you do. And if you're like me, you've heard about UTIs, which again is a urinary tract infection, and you maybe even had one in your earlier days when you were younger. But surprisingly, I was very surprised. I was shocked to learn how UTIs impact women during menopause and postmenopausal, well into their 70s and 80s. Shocker, right? At least it was for me. So again, I just went out there to do a quick search, and this is the information that I'm finding and I'm providing back to you. So menopause causes UTI primarily due to a significant drop in estrogen levels. So as we go through menopause, our estrogen levels lower, and then that can be a cause for the UTI for us menopausal, postmenopausal women. During this hormone reduction, the lowering of the estrogen, it thins the vagina and the urethral tissues. It raises the pH balance in making our vagina less acidic. It raises the vaginal pH, I should say. It disrupts healthy bacteria, and it weakens the pelvic muscles as well. And all of these things allow for the bacteria to easily enter and to thrive in our urinary tract. Hence why that are menopausal, postmenopausal can get UTIs much easier. Okay, so these kind of hormonal and even the physical changes can trigger a plethora of issues that leave the urinary tract vulnerable to infections. So I want to go over 5 of them for you. The first thing, like I just mentioned, was we're going through menopause and the estrogen is lowering, then we have tissue thinning. So estrogen helps to maintain the thickness and the elasticity of the urethra and the vagina lining. Without it, when we don't have any more estrogen or it's low, tissue becomes thin, dry, and fragile, and it makes them highly susceptible to irritation and tiny tears. And that, leaves the door open for a possible UTI. The second way is an imbalance. I think it's pronounced microbiome imbalance. So estrogen also fuels the growth of beneficial bacteria that keeps the vagina acidic and fight off harmful pathogens with the germs like E. coli. So as our estrogen is lowering, we lose the battle to fight to fight off the harmful germs like E. coli that try to enter our body. So a lack of estrogen causes the vaginal pH to rise, allowing harmful bacteria to multiply and colonize in the area. So first we have the tissue thinning, second we have the imbalance, and third we have the pelvic floor weakness. So declining estrogen also affects the muscles supporting the bladder, which can lead to an incomplete bladder emptying. So all of that stagnant urine creates a perfect breeding ground for bacteria. So you're not totally emptying your bladder out, and so that bladder is just sitting there. So the bad bacteria is like, yay, we got a home, right? So the first one is the tissue thinning. Then you got the imbalance, the pelvic floor is weakening, and now we're going to talk about urethra changes. So the decrease in estrogen causes the urethra to become more delicate and can shorten the distance bacteria must travel to reach the bladder. So the changes there. So that's the fourth one. This last one I was really shocked about is they say in women over 85, roughly one third experience one UTI annually due to weakened bladder defenses or the use of catheters or underlying conditions like diabetes. So women that are 85 and up, roughly one third, they say, experience a UTI due to a weakened bladder, use of catheter, and underlying health conditions like diabetes. It also states in older women, UTIs are the leading reason for antibiotic prescriptions and can manifest as confusion and delirium, rather than a traditional plan or symptoms that you would see that I read earlier for other people. So this is what happens with with women that postmenopausal. So we have the tissue thinning, we have the hormonal imbalance, we got the pelvic floor weakening, we got the urethra changes, and we have being elderly and put us at a higher risk. So they said menopause related urinary tract infections primarily affect women 45 and older, which is around the time you pretty much start your menopause. So, but it goes up even higher, escalating significantly in the 65 to 85 plus age group. So urinary tracts for menopausal women, it can start when you're 45 and older, but you have a greater increase of getting it between the ages of 65 to 85 plus age group. So while natural menopause typically occurs between 45 and 55, the reoccurrence of a UTI continues to climb as estrogen levels drop further in postmenopausal elderly women. So what I took that to mean is that yes, you start, your menopause phase anywhere between 45 and 55. But as you continually go through the phase of menopause, postmenopausal, as your estrogen level continually drops, you have the higher risk of having UTIs more than once reoccurring for that. So I just want to stop and pause and say this. So if you are diagnosed with a UTI, know that it's not you, it's the hormonal changes due to menopause. So, and I just wanted to go over some, common UTI symptoms. So, you'll know what the common ones are. And then I'm going to talk about some of the ones that affect older women. So the most common ones are a strong, persistent urge to urinate, a burning sensation during urination, frequent urination, often passing small amounts of urine, and cloudy, strong smelling urine or blood in the urine. And remember, I always say, if you see blood anywhere, call your doctor immediately. Pain or discomfort felt in the lower pelvic area just above the pelvic bone. So those are some of your regular UTI symptoms. But symptoms that are more common in older women can be a little different. And they can be a little subtle, and they can be harder to identify in older women as well. So here are some of the few ones that I was able to find. So you have a loss or inability to control your bladder, resulting in accidental leakage of urine. There's fatigue and general weakness. There's a loss of appetite. There's an increased falls happening, and and there's confusion and delirium. So this says that research has shown women that are 70 and those with dementia are at a higher risk of suffering from confusion from a UTI. So, women older than 70 and those with dementia are at a higher risk of suffering from confusion from a UTI. And this may be because of the inflammation from a UTI and has a better chance of affecting the brain of an elderly person. And because the patient may not be able to communicate their symptoms, you know, it might go undetected as well. So this might be, this might be something, we should be looking into, especially if you're a caretaker taking care of someone elderly as well. And they said up to half of people with dementia visit an emergency room in a given year and most frequently are diagnosed with a UTI. So patients with dementia visit an emergency room in a given year, and they're most frequently diagnosed with a UTI. So that's something, like I said, for us to be paying attention to as we get older. But also, if you are caretaking or know someone older, you can probably present that or have that information ready if that is not thought of, if you notice something's going on with a person. So, UTI treatments. So, there are treatments for a UTI. And, because this is bacterial, if you think you have any of the symptoms or you're not sure, it's best to talk to your doctor about it because it's bacteria. And we all know there's nothing good when bacteria lingers in your body or lingers anywhere. It's not good for us, right? So treatment normally is something that involves a short course of, your doctor gives you some antibiotics, maybe like a week. And they say that even if you get the antibiotics, that you should take it for as long as your doctor prescribes it to you, even if you're feeling better. And I totally agree. If it's for the full 7 days, I'm just making up a number. I don't know how long the prescriptions are. But if it's for whatever the duration is, take it as prescribed. Take it as your doctor tells you to do. Don't diagnose yourself. Let's get this taken care of and effectively, right? So, if you are experiencing, though, UTIs, reoccurring UTIs, they are defined as having 2 or more UTIs in 6 months or 3 or more UTIs in a year. You might have to consider something different than the treatment of just having, the antibiotics. So again, they did say women that are older, and as we get older, our more estrogen is leaving, is declining. So we have a greater chance of getting not only UTIs, but recurring UTIs. So with that being said, we need to really pay attention to that. So if we get antibiotics and they're not working, you need to go back to your doctor and say, this isn't working. So some of the suggestions that they say that are, would be, helpful for people with reoccurring UTIs is vaginal estrogen. For some postmenopausal women, having a low dosage of vaginal estrogen is available by prescription, can restore a healthy and vaginal tissue to reduce the UTI risk. Another thing is having an antibiotic. Is prophylaxis. So prophylaxis. Research has shown taking antibiotics regularly to prevent the infection. So this is something definitely you would definitely need to talk to your doctor about. What are the risks of, of all of these? I'm only mentioning 3. What are the risks of all of them so that you will know what's the best plan of action for you and your health. So, and then they also have a non-antibiotic prescription medication called Hyprex, Hyprex, that can also help prevent reoccurring UTI. So they have the vaginal estrogen, they have the antibiotic, and then they have the non-antibiotic for those that are suffering from continual UTIs. So just to put that out there. So I would be remiss if I didn't express the importance of, if you feel that you have any symptoms or anybody that has any symptoms, that you immediately go and get this taken care of with your doctor, right? Because if left untreated, urinary tract infection can lead to death. And no, I'm not trying to scare anybody or put fear in anybody. I just want you to have all of the information so you can make a well-informed decision about what's happening in your life and the life of your family and friends and others, right? So they said that UTIs may lead up to a form of sepsis called urosepsis. So the mortality rate of severe sepsis is between 20 and 40%. Infections are a major cause of hospitalization and death in nursing homes. So, if left untreated and it becomes severe, it can go to sepsis, which is urosepsis, which is what caused the death. And the mortality rate is severe when it's like up to 20 to 40%, right? And so this infection is a major cause of hospitalization and death in nursing homes. I thought that was pretty interesting. And they said in the US alone, thousands of women die annually as UTIs escalate into sepsis or urosepsis. And it made me think about it too, because if you're not, like they say, as we get older, it's subtle, so we may not be thinking anything of it. I think at this point, is all the stuff I'm learning, we should think something of everything. Not that we become hypochondriacs and think, oh my God, something's wrong. We don't want to live a life like that, but just to be aware, of symptoms and pay attention to them. And I think to myself right now, I think about the elderly and the caretakers, they need to know these kind of things too, because if you're taking care of someone that cannot advocate for themselves due to dementia or whatever else they're going through, having a well-informed caregiver, that person in the family is, sometimes, I do my research, I type up a little script with some bullet points, but then sometimes as I'm talking in video in this, it does hit me like, wow, women go through so much. Okay. So yeah, sorry, but not sorry, right? I think that's what makes us so unique. No matter what our race, our ethnicity, we're all women going through the same things, at different paces. But yeah, so the risk of a severe outcome, it increases significantly with our age and the reoccurring affections, primarily, of course, like I said, due to the low estrogen causing the thinning of the vaginal tissues, which is important to know. However, see, I don't want to leave you with the bad news. I like good news, right? So, however, there was an analysis done of nearly 2 million postmenopausal women, 2 million, and they found that the use of vaginal estrogen was associated with roughly 70 to 80% reduction in mortality risk compared to those that didn't take it. I'm repeating that again, right? So you can hear it for the people in the back, right? So they did a study or an analysis of nearly 2 million women. I think that's a good group of postmenopausal women, 2 million postmenopausal women. And they found that women that use the vaginal estrogen had, the mortality rate was 70 to 80% in reduction. I love to hear the good news, right? But compared to those that didn't take it. And probably those that didn't take it, again, so many times we're dealing with stuff, we don't even know that we're dealing with stuff. That's why I think it's important that you have a primary care physician. I think that until the day you leave this earth, everyone needs to have a gynecologist. I definitely think that. So much is going on with our uterine health that we need to know. So some of the other things that I found that we can do ourselves to help us out is drink water. Flush out the bacteria. So even as I sit here today, I have my big thing here, right? Drink water. But I'm a water lover, always have been. And I could drink maybe 2 or 3 of these a day. So that's just me, though. I'm not saying that you need to walk around with the people I see with a gallon jug and you drink a gallon of water a day. You'll know how much water you should drink. Ask your doctor, because your doctor knows your health condition. But they say drink water. Drinking water flushes out the bacteria. And I know a lot of people like to drink. I say drink regular water. Some people, this is me giving advice, right? Because some people drink other things, but they have a lot of sugar content and things of that nature in it. Come on, we can do this. And then they also talks about, the postmenopausal can apply low dose vaginal cream to support the tissue and maintain good health. I wonder if we can just ask for vaginal cream in it, being proactive instead of waiting. Because if the vaginal cream, see, this is how my brain works, and that's why I go down deeper research. So probably another video is coming like that. So, because I'm thinking that if we get vaginal cream, estrogen cream, and if it supports tissue and maintains good health, can we be proactive rather than reactive? That's a good question, isn't it? Okay. And the other thing it says is to eat high probiotic food, which supports the good bacteria. You know, you talk about taking cranberry supplements and juice are recommended. I know I started drinking cranberry juice way back in my 20s, I think, when I heard about UTIs and, you know, how cranberry juice was supposedly good for your uterine health. So I was just like, oh, cranberry it is. And so I do that. And I don't do all the flavors and things of that nature. I just, you know, cranberry juice. I even like to buy cranberries during the season because I love to cook with it. So yes. So I hope you can see, you know, why I'm so passionate about sharing this type of information regarding our you know, our uterine health with you, you know, because this is something that I didn't know and maybe many of you didn't know, and now you know. So when you know something, you're accountable for it, is what I always know. So hopefully this information and the various types of things I talk about on this channel, I share with you, can help you develop, you know, a plan for yourself for healing, or maybe if you're a caretaker and you have an elderly person, or if you are an elderly person, maybe this is some information that you can share with your doctor as well to bring about a form of healing for you. You know, if you know you have these symptoms, you might want to dig a little deeper in your own research, because like I said, we're all different. We all have underlying conditions. Some of us don't. So what works for me might not work for you. So I hope that these all, you know, are helpful, you know, because I try to bring awareness so that there is no shame, there is no stigma. You know, if you find yourself diagnosed with a UTI and you're postmenopausal, it's nothing to be embarrassed about. It's part of menopause. And so now you know it's hormonal. It's not you, you know? So I hope this information that I share is very helpful. Again, I was quite surprised to see how UTIs were so common among older women. And I knew I had to share this with you. So that's why I started off with the previous video talking about what a UTI is and how it did affect our uterine health. But I really wanted to talk on this subject as we are getting older and there's so many different aspects to menopause. And so now we know. So I'm going to leave you with some references, and they will all be listed in the description below. So the first references that I took information from was from the American College of Obstetricians and Gynecologists. It was from August 2025, and it's entitled UTIs After Menopause, Why They Are Common and What to Do About Them. The second one is from Biotic. It's from March 2026, this year. Frequent UTIs during menopause, cause, treatment, and prevention. The third one is from Harvard Health Publishing. So that was from May 2025. UTI in older women, why postmenopausal women are susceptible to urinary tract infection and what to do about it. And the fourth one, it just kind of came up in my research, was from NBC News, and this was from January 2021. Tanya Roberts, she was a well-known actress, died from a urinary tract infection that caused sepsis. I thought I would just put that in there. So that link is there. And the last one is from the Urology group, and this is from November 2022, 4 complications of UTI among older women. So I hope this information, like I said, was very, you know, helpful to you and you learned something new. And I hope this inspires you to take better care of yourself and to understand that you don't have to be a superwoman and that some things that are happening in our body is not about you. We can blame it on menopause. So until next time, you take care of yourself. If you're not feeling well, please go to the doctor. And if you are a caretaker for an elderly person, at least this is something that if the doctor didn't talk about before, maybe you can bring up in the next visit as you are caretaking for the individual in your life. Take care.